everyone, my name is Basmala and today we are going to talk about an important topic. It's the relationship between depression disorder and nutrition. This presentation is a part of Functional Foods course in the Dairy Science and Technology Department at Faculty of Agriculture Alexandria University. It's prepared by our team Alaa Saeed, Basmala Yasser, Habiba Ahmed, Nancy Fathi, Noor Rahman Ashraf under the supervision of Professor Mohammed El-zieny. And these are the contents we will talk about today. So let's start with an overview of depression. Depression is a common mental health disorder that affects how a person feels, thinks, and behaves. It can cause sadness, loss of physical interest in activities, and even symptoms like fatigue and sleep problems. Many factors contribute to depression, including genetics, environment, and lifestyle choices. According to WHO, about 5% of adults suffer from depression, and women are more likely to have depression than men. Second is symptoms and patterns. Depressive episode is different from regular mood fluctuation, so let's talk about the main symptoms like sadness and hopelessness. People with depression often feel sad or hopeless for long periods. Change in appetite or weight. Some people eat too much or too little, leading to weight gain or loss. Sleep disturbance. Depression can cause insomnia or excessive sleeping, fatigue or loss of energy. Many people with depression feel tired all the time, even after resting. Difficult to concentrate. It can be hard to focus, remember things, or make decisions. These symptoms can vary from person to person, and not everyone experiences all of them. Depression is not the same for everyone. There are different types, each with its own characteristics. Depression can be classified into two ways, by frequency and severity. By severity, depression can be mild, moderate, or severe, depending on how much it can affect the daily life. Or by frequency, if a person experiences depression only once, it's a single episode. But if they happen multiple times, it's a recurrent depression. Like imagine someone who felt depressed once in their life but recovered. That's a single episode. But if they keep having depressive episodes over the years, that is a recurrent depression. And within each episode, it can be mild, moderate, or severe. Unlike regular depression, bipolar disorder involves mood swings between depressive episodes and manic episodes, where the person feels overly energetic or euphoric. This includes feeling extremely happy or easily irritated, along with a decreased need for sleep. Now, let's move on to the causes of depression. There are different factors that can increase the risk of depression, including genetics. Some people inherit a higher risk of depression, or environmental factors, stressful life events like trauma, health conditions, having other mental or physical illness, or lacking of social support. Depression and nutrition are strongly connected. The way we eat affects our mental health, and in turn, depression can change our eating habits. Malnutrition means not getting the right nutrients, and it comes in different forms like undernutrition, not eating enough, leading to weakness and low energy. Overnutrition, eating too much unhealthy food, which can lead to obesity and health issues. Nutrient imbalance, lacking important vitamins and minerals that can support brain function. So, this diagram shows us that depression and malnutrition affect each other in both directions. Malnutrition can lead to depression, and depression can lead to unhealthy eating habits. Fourth is brain and depression. Here we can see a diagram of the brain highlighting important areas related to depression. One of the most important parts is the amygdala, which can control emotions like fear and stress. In people with depression, this part becomes overactive, making them feel anxious or sad more often. Another key area is hippocampus, which helps us with memory and learning. In people with chronic depression, the hippocampus can shrink, affecting concentration and decision making. The prefrontal cortex, which helps us control our emotions and making rational decisions, also show reduced activity in depression. Did you know that what we eat can affect our mood? And it's not just about the basic nutrition, there is a whole category of food called functional foods that have specific benefits for our mental health. We are going to talk about the connection between functional foods and mental health. Functional foods are food that have a health benefit beyond basic nutrition. Functional foods have antioxidant and anti-inflammatory properties. This makes them beneficial for preventing mental illness like depression. They can help reduce protein buildup and improve mitochondrial function. The brain and gut are connected through the brain axis GPA. This means that what we eat directly affects how we feel. For example, serotonin, the hormone that's responsible for happiness, is mostly produced in the gut. If we eat unhealthy food, it can lead to imbalance that can affect our mood. Actually, daily intake of probiotic have been shown to improve depressive symptoms. Specific strains like lactobacillus and bifidobacterium produce gamma-aminobutyric acid GAPA, a neurotransmitter that regulates physiological process. And nutrients like omega-3 fatty acids and B vitamins help produce neurotransmitter that is serotonin and dopamine, which is improve mood and reduce stress. This image shows the difference between healthy and unhealthy food and their effect on mental health. On the left, we see food rich in vitamins, minerals, and healthy fats, which support brain function and reduce stress. On the right, we see food high in sugar and unhealthy fat, which can lead to inflammation, poor gut health, mood swings, and even increased risk of depression. And that's why maintaining a healthy diet is essential for both our physical and mental well-being. After all, we are what we eat. And now, my colleague Habiba will continue with the role of nutrition in treating depression.
Now we will talk about the role of nutrition in treating depression. Nutrition plays a critical role in the treatment of depression, working alongside medication and psychotherapy to support mental health. Omega-3 found in fish, seafood, seeds, and nuts. Consuming at least 2 servings of fish per week and 30 grams of mixed nuts daily is recommended for preventing major depressive disorder. Omega-3 have antidepressant mechanism, including anti-inflammatory prebiotics that enhance dopamine. Studies suggest that DHA, EPA from fish or supplements have a protective and antidepressant effect, while ALA from seeds and nuts, especially walnuts, can help prevent and alleviate depressive symptoms. Then vitamin D and vitamins from B complex. Vitamin D found in fish, animal products, mushroom, and fortified products. The recommendation is 2 servings of fish per week. Vitamin D influences the immune and gut microbiota modulation. Studies suggested that regarding the possible antidepressant effect of vitamin D intake, although its low consumption worldwide can be involved in the high prevalence of major depressive disorder. Vitamins from the B complex found in fruits, vegetables, animal products, or supplementations. Intake recommendation is 800 grams per day of fruits and vegetables are recommended as a part of healthy dietary pattern. Antidepressant mechanism is anti-inflammatory and biotropic actions. Studies suggest that low levels of these vitamins may contribute to inflammation, but consuming, as we said, over 400 grams of fruits and vegetables daily is the best way to improve vitamin levels. Then caffeine. Caffeine found in coffee and tea. Antidepressant mechanism of caffeine is neuroprotective, targeting of the dopaminergic system through the non-selective adenosine antagonist action. Zinc and magnesium. Magnesium is found in nuts, seeds, whole grains, and dark leafy greens. Zinc found in meat, shellfish, nuts, and beans. Antidepressant mechanism. For zinc, studies suggested that deficiency of zinc may contribute to depression, and magnesium is important for relaxation and stress reduction. They help regulate neurotransmitters like serotonin and dopamine, reducing stress and anxiety. So, low levels of zinc and magnesium is associated with increased depression severity. Nutritional tips for preventing and managing depression. A well-balanced diet supports mental health by enhancing brain function, stabilizing mood, and reducing inflammation. Key strategies for preventing and managing depression through diet include 1. Eat whole nutrient-dense food while minimizing processed food. 2. Incorporate mood-boosting nutrient. 3. Support gut health, include probiotics and prebiotics. 4. Maintain stable blood sugar. 5. Stay hydrated. 6. Limit caffeine and alcohol. 7. Practice mindful eating. Now we will talk about some practical tips for managing depression. Depression is treatable with therapy or medication, so consult a therapist or use WHO's mental health resources. Social interactions provide emotional support, so stay connected and check in regularly with friends and family. Exercise helps release endorphins and improve mood. Start with short daily walks and gradually increase activity. A structured daily routine adds stability, so you can set a consistent time for meals, sleep, and activities. Practice self-care and take care of yourself by making your mental and physical health is a priority. Eat well, rest, and engage in relaxing activities. Major depressive disorder is complex. There are many factors at play, but diet is one we actually control. When our diet lacks essential nutrients, it can contribute to the development of major depressive disorder. But the good news, dietary change, especially eating more fish, nuts, fruits, and vegetables, can help manage or even prevent it. Nutrients like omega-3s, vitamins, and polyphenols actually influence the brain health and mood regulation. Research shows that the Mediterranean diet, rich in these nutrients, protects not just against major depressive disorder, but also other chronic diseases. However, it's important to remember that results aren't immediate. Long-term benefits of dietary change take time to be observed. So, to sum up, depression is a complex disorder influenced by multiple factors, including nutrition. Maintaining a balanced diet can help manage and even prevent depression. Thank you for listening.